It is so good to see you guys, and thank you very much for your busy Saturday, and we can able to still meet together for our lecture before the year end. That's the reason. Actually, I think you'll be very happy to have this webinar. The reason why is the following: a lot of people don't even know what is aneurysm, and a lot of people have no idea, and especially pre-diabetic, diabetes, high blood pressure, cholesterol people, a lot of people do not know about this. So net result, they go through life as usual, nothing changed, and end up suddenly it's kind of hit them. And that is really sad. And I have lots and lots of patients when I was an ICU nurse had the same kind of experience, and many of them actually died, and many of them all became really difficult in the sense that they are lying in hospital or care home for years, and some few years lying in a care home is not really what you want to do with a quality of life, right? So I thought it would be good, at least we could provide you some information so you can start understanding, okay, what is really aneurysm all about? And at the end of the day, I hope that you could at least start looking into it and start doing something about it in your lifestyle changes, that is. Especially people who are already pre-diabetic, diabetes, or cholesterol high, high cholesterol, or blood pressure is high. So these is really my desire, the reason why I structured this lecture. And I thought that would be really helpful for people to understand what happened. Especially, we are now getting old. We are 60 years old, something like that, or 50 something. You will start getting to that age range that it will be a risk. So this is something that we have to do. So anyway, without further delay, I will start off this webinar, and I'll get to share the screen. And maybe perhaps someone can like Adrina, can you see my screen so I could make sure to get this give me a 1 if you can, and then I will know that you can see me very nicely. OK， 各位朋友，首先多謝各位喺一個咁忙碌嘅星期六早上咧，係大家同我哋傾下偈啦。咁其實有個原因咧，點解我會做呢個 lecture 嗱？其實好重要。點解做呢個 lecture 咧？第一 ，I don't think you guys see your screen. Okay, hold on. Hold on. I'll just make sure that you guys see the screen. Okay. Okay. Can someone give me a 1 if you can see the screen? Okay. Yeah, I think you guys see the screen. Okay. Anyway, let me share with you again one more time. There is a reason why I actually do this webinar, and I explain English, now I explain Chinese. 其實各位朋友點解咧，我係今日會做呢個 webinar 咧？其實好重要嘅，因為咧喺我 ICU 做 ICU 嘅即係嗰陣時嘅時間咧，我見到好多病人入嚟咧，當如果佢有 aneurysm 咧，個生命係好即係嚴重啦，即係佢可能會死啦。最弊咧，佢死唔到咧，6年裏邊咧要瞓喺張床度啦，唔喐得啦，哇！呢個好痛苦喎，即係冇咩嘅好嘅，所謂叫人生嘅嘅 life 啦。咁我覺得呢樣嘢，如果我哋可能夠防禦到嘅，會 very good，right？ 咁有陣時咧，糖尿患病者同埋前期患病者兩個同埋有血壓高同埋呢個減存高咧，個 risk 好大嘅。咁所以今日咧，希望呢個 lecture 咧俾多了解你，咁你能夠咧開始做啲防禦工作啦。So today I think maybe this lecture or this webinar will give you something really a good insight to let you understand what's happening. And I think with that, you can start realizing this is something that you could do something about it and prevent and be healthy and never get into the stage. Isn't that great? Because that will be tremendous stress on the family, yourself, and everybody. Okay, let's go start. Now, before we start, because I saw a lot of names here is also new to the group, and I don't think I saw names that are familiarized. So I think I'm just go through like few minutes real quick to update what is diabetes, how LOWSUTEA can help you, then go into the brain aneurysm, and that way you can understand what we talk about. 咁今日咧有好多堂友咧，我今日係唔知係邊個嘅，因為好多未 recognize 咗名啦，咁可能係不同地方同埋香港嘅新朋友啦。咁我要講講咩叫做糖尿病先，咁變咗嚟講咧，你可以多啲了解。Okay, everybody actually go to 4 stages of diabetes. Some of the old group is say, hey, I heard this before, but it's important to remember this over and over again so you can always in your brain to refresh and understand what's happening. So that's why we try to keep doing that. But more importantly, you understand diabetes has 4 stages. One, the first stage is your cholesterol, LDL cholesterol goes up. It will damage the B cells. The B cells, the cells that take the sugar into the cells. When they damage, more B cell coming, but doesn't work. So more blood sugar will go up in your vessels. So the blood sugar and the cholesterol get together, your blood become very thick. Net result, you're going to move yourself quickly to stage 2, whereby you have all these plaque forming and your blood pressure goes up. Now, this is highly related to the topic we'll talk about, what is the aneurysm. You will find out a little bit more what is that. I tell you, this is something that you all linked up now. Okay, all these plaques will continue to form throughout the body, brain, heart, everything. So that's why diabetes is so detrimental. It damages your entire body. And that's why I thought that you always have to remember, you have to keep your blood sugar low and cholesterol low, because it becomes thick, blood pressure goes up, and it'll hurt your entire body. Now, you move quickly to the 3rd stage, because everybody will measure your blood sugar via a system called A1C, hemoglobin A1C. Everybody have this hemoglobin cells, an amount of sugar attached to this hemoglobin, maybe 5.7% lower than your normal person. If you're over 5.7 to 6.4, you are pre-diabetic. And then after 6.4, you are diabetic. But unfortunately, when you're pre-diabetic, there's no medication for you. Doctor recognize you're between 5.7 to 6.4. They say, hey, you're pre-diabetic now. You got to be ready to take care of yourself. You better don't eat too many sweets. 80% of people will have no idea what to do, and they will continue the lifestyle. Net result, very quickly, 3 years, they don't do anything. They will change themselves to a diabetes 6.4 and up. They are diabetes. Once you convert it, you cannot convert back. Even though your blood sugar continue to be lower, but you are still called a diabetes. So doctor usually give you a little time to, have your chance to move it down. But if you don't do it within a year, you continue about 6.4, aloha, you will be a diabetes. And that's not good. It will increase your insurance, everything goes up. So you don't want in that stage. 嗱，各位堂友，每個人咧都係 go through 有4個 step of become 一個糖尿病病者。第一個咧就係你 LDL 膽固醇上升啦。當你 LDL 膽固醇上升嘅時候咧，咁就會破壞咗一啲膽固醇，破壞咗 B cells 啦，個 B cell 移到出嚟 ，B cell 帶啲糖入翻去細胞度。如果膽固醇亦都繼續上升，你啲糖咧要一路高咧，咁啲糖同埋膽固醇加埋咧，就你血好結，好結之後咧，你就會去到 stage 2嗰啲血壓就會上升。個原因就係膽固醇同啲血糖咧好結嘅時候咧，就開始塞，form咗好多啲咁嘅板塊血塊，咁變咗嚟講咧，你個血壓一定上升嘅。咁第3個 stage 嚟喎，第3個 stage 係你嘅糖喺度上升啦。咁咧你每一個醫生都 measure 你呢個係即係你個紅血球，呢個叫 hemoglobin。呢個紅血球咧就睇下幾多 percentage 嘅 sugar 係黐住個紅血球。如果你上去多過5.7嘅話，咁你就已經前期患病，至6.4都係前期患病。嗱，好可惜你前期冇藥食嘅，醫生只係話：喂，你而家前期患病啦，要開始注射啦。咁多謝話你唔識咁甜嘢啦。可惜你唔食咁多甜嘢，唔係呢個只係就係好多步驟啦。exercise 減肥都冇講喎，咁變咗嚟講，你繼續個生活咧就好快脆，3年後咧，大多數啲人咧就變咗糖尿病，哇，變咗一世啦。因為講呢個改變生活習慣係好重要，一過咗6.4咧，你就已經去糖尿啦。住一段時間你翻唔到轉頭咧，醫生就變咗你話咩？你呢個糖尿病病者，咁你樣樣都係驗疏高咩都要係有問題嘅。咁所以變咗嚟講，希望你真係唔好繼續喺個，就算繼續 lower 6.4冇問題，繼續係努力，咁你身體更加健康嘅。OK。 So if you don't do much, you become a diabetes. The problem you have is you're going to have all kind of problems in health. In other words, you have a problem with potential stroke, you have a cataract issue, you have a pancreas issue, and then you also could have problem like heart, because it's plug up your heart vessels, and then worse yet, you will have your blood pressure will go up and your heart vessel become your blood vessel become hardened and can be damaged. The worse, you have nerve damage, you can feel the pain, and even a heart attack, you don't even know, you thought you have a stomach pain. All these issues come, and you got injured, and it won't heal, and your foot become gangrene, you got cut out a foot, and then if you plug up your kidney, and 70% of the diabetes patient will have some form of kidney disease. So you don't take care of it, your kidney is going to end up is got damaged, and if you become only 30% function, you're going to end up with dialysis, and that's what we said, because that would be total wreck of your life. You don't want to do that. And then you have because you can't feel, so you have sexual dysfunction. You cannot feel, then your sex life is go whacked up. And if you're pregnant now, don't forget, you're pregnant right now, you're okay, but unfortunately, if you after get well, eventually you have a high risk to be diabetes, so you have to watch that.嗱，各位朋友，如果你係已經係二型糖尿病咧，咁你有好多不同嘅併發症啦，併發症就係中風啦、白內障、青光眼啦，同埋又要打胰島素啦，你個心臟會塞得好緊要咧，咁你會心臟病啦，會死喎呢個嚇，記住啊！咁血壓會高啦，仲有 damage， 你破壞咗你血管啦，硬化咗啦，咁陣間講埋咧就會爆血管啦個情況啦。咁神經系統損壞都好大問題嘅，即係你heart attack嘅時候你冇感覺嘅，你冇咁痛啊。咁個問題咧，你可能真係唔去睇醫生，咁就會死亡啦。咁仲有咧，如果你腳壞咗之後，咁你又斬咗腳真係好慘啦。咁同埋咧，仲有咧，糖尿病個腎病者咧，好多時咧有啲病人咧係因為70% 嘅糖尿病者都有呢個腎病嘅，咁變咗嚟講咧，如果你去到30% 個腎功能咧，你就可以要洗腎啦。咁同埋咧，性功能你都冇，因為冇感覺啊。咁同埋咧就懷孕嘅併發症又高，咁你變咗係又喺呢個糖尿病呢個情況係好高嘅。So how does LOWSUTEA will help you? Now, LOWSUTEA have two ingredients. One is the guava leaves, will take sugar into the will delay the absorption of sugar into the blood vessels, which got less sugar in the blood vessel. But even though blood sugar in the blood vessel, they have bitter melon, which is a really wonderful thing. It increased the insulin sensitivity, taking the sugar into the cells and take cholesterol, sodium, and sugar from the urine. Even though you have excess, they dumped it out on urine, and so net result, you have sugar come down, your cholesterol come down. Because salt came down, your blood pressure also come down, plus is detox. So net result, you have a really keep yourself healthy. Now, a lot of people are actually drinking now also because maybe they have, with that, plus they have some diet changes, they also start losing their weight. So really, at the end of the day, it's not only the 3 high you can lower, but also your weight. So isn't that wonderful? So keep doing the drinking, because that will definitely help you. But by the way, if you go to a buffet, it's okay, drink a little more. It's not an issue, because especially if you are eating a buffet, I eat a lot more food, then it's okay, drink one more bag, because this is not a drug, this is just a supplement. So drink a little more can definitely help you. 各位同學，其實虛糖就係有2樣嘢，第一就有個叫做番石榴葉啦，番石榴葉又減低啲糖咧進入你血管裏邊，咁你少糖喺血管裏邊咪更加好。但係就算有多糖喺個血管裏邊咧，呢個苦瓜咧就增加咗個胰島素嘅敏感度，咁就帶翻啲糖入去邊啊？細胞裏邊。第二樣嘢亦都咧係幫助咗你咧係有一個好嘅東西，掉咗膽固醇啊，同埋掉埋你嗰個鹽啊出嚟。咁你糖低咗，掉糖出嚟，掉咗糖，掉咗膽固醇，亦都掉埋個鹽咧，咁你血壓亦都會降低，同埋幫你排毒。咁好多人咧飲咗呢樣嘢嘅時候咧，佢三高低咗啦，仲有一樣嘢咧，佢腳腫都唔見埋。仲有咧，好多人咧依家開始磅數都減埋，因為可能即係因為抌晒嘢之後咧，佢 低又有 cell control 啦，咁更加好。所以呢啲嘢係全部幫助更加身體健康嘅。所以唔係一定要糖尿病先飲㗎，係總言之，你係可能夠幫助你健康啲嘅減低膽固醇啊、血壓啦，同埋你嘅血糖咧，其實你係任何年齡都可以飲到，同埋幫助你更加身體健康。And our company has 3 things to help you. Well, 5 programs to help you basically. Basically, will help you, teach you about diet, teach you about how to eat low fat, low carb diet. We'll teach you how to exercise with 10,000 steps per day and 150 minutes per week. We have weight control that was BMI lower than 23. And then we do webinar, which like we're doing today. And then we teach how to track your blood. Okay, so you have a complete program of holding a hand throughout your diabetic or pre-diabetic journey. And hopefully that you can continue to be motivated and become better health. I have so many patients now. They were 10 plus A1C above, and they brought themselves back to under 6 or about 6 something, not over 6.4. And they have become very healthy, and they were so happy being this stage. And they continue to drink LOWSUTEA to help them and start seeing my webinar. So that is something that you need to continue to do, because if you do that, you can help you tremendously. 各位同友記住咧就係我哋咧我哋公司咧就係有5個 program 嘅。第一個 program 咧就係教你點食嘢啦，飲去糖茶啦。降低碳水化合物食物啦、脂肪啦，同每日運動啦，全部有晒嘅。你去個 YouTube 睇晒啲 program 都得㗎，我哋個網站都有嘅。點減磅啦、23個 BMI 啦，醫生講就每個禮拜都有啦。同埋咧，我哋每日量度咧點去糖。嗱，其實我好多病人咧係個 A1C 已經高過10咧，去跌翻去6.4 以下，咁好開心喎，因為咧佢哋身體覺得十分魔健康啦。咁同埋咧，好多人唔使打胰島素啦。繼續食藥，其實食少藥啦，有2000個 milligram， metformin 可以食到500個 milligram 啦，好多呢個 example 已經。咁所以變咗嚟講係對你好嘅。重要點就係繼續努力，我係拎住你手咧，幫助一齊行，然後咧鼓勵你同教育即係俾啲資料咧，咁你知道點去 manage 你個前期患病或者糖尿病病，或者你個膽血高點去幫助你啦。Okay, so we catch up everybody, and now we are very important to really talk about what is brain or cerebral aneurysm. Okay, so cerebral is more a medical word, but brain, everybody knows brain, right? And that is really a very important topic. Okay, 嗱，今日好特別咧，我一定要講咧咩個大動脈嘅瘤嘅事實。咁你有了解咗之後咧，咁你試咗係防禦噶嘛。So today the lecture is going to be very important to help you to understand what is cerebral or brain aneurysm. I hope a lot of people, you might say, oh, I didn't hear it before. It's okay, because I will take my time to explain what is a brain aneurysm or cerebral aneurysm. Now, you see right now in the pictures on the right-hand side, this is not a grate. It is actually aneurysm. And so I will take my time to explain how this works, and I think that is so important to understand. Now, aneurysm actually is a bulging or ballooning of the blood vessels, okay, in the brain, okay? And this is all the brain vessels, and unfortunately, that's the bulge right here, and this is the vessels, okay? And this, a lot of people call the berry hanging on the stem is a typical representation of aneurysm. Now, actually, 90% of aneurysms look like this, okay? Now, this aneurysm, the problem is as they grow older, they all, as they go bigger, let's put it this way, they also compress to the neighborhood vessels, like the brain here, they compress on the brain. So you're going to start seeing some symptom, and then you're going to get, later on, we'll talk more about what is that symptom is going to be. But that is actually better situation, because you now start feeling, hey, I have some problem because I get headache all the time. or I got blurry vision all the time, or I got numbness or cannot move. But that is really good because at least you have symptom. Unfortunately, a lot of this aneurysm does not have symptom. Imagine that you have no symptom and you have a gigantic balloon here. If this bursts, you are in trouble, because you know why? If it bursts, the blood will go fill up into this area of the brain, and then you will continue to fill up until it will stop. But the problem is when you start filling up, the brain is also going to swell. And when the brain swell, the brain is in a skull, protected by a skull. And you really cannot allow this thing to go expand further. So net result, the brain will have forming a big edematous, meaning the big swell, but nowhere to go. So your brain will start pressing all the nerve. Eventually, you maybe potentially stop breathing and you die. Okay. And so this is called a hemorrhage, aneurysm or stroke of the brain damage. And usually many of these people, first they have that, they will still alert for about maybe half an hour to 1 day. And if they continue brain, continue to bleed, and it'll bleed more and more and more, you know what? The person, you're not stopping the breathing, you're not doing brain surgery, especially elder folks, they usually die. And I tell you, my mom died the same issue. She has no idea what's happening. She only have hypertension, and then dispersed. And this is very common. I saw it many times, many patients. That's why I want to show you. This is exactly what happened to a lot of people who have a hemorrhage aneurysm. Now, it would be good if you just having this and compress the the brain tissue, that at least you can able to do something about it. But usually when you hemorrhage aneurysm, the chances for you to do something is very limited, because of the fact that either you can go open the brain and stop the bleeding. If you don't, chances of surviving is not good. Okay, so just make sure everybody on the same page. 嗱，各位朋友，咩叫腦動嘅動脈瘤咧？咁其實好簡單嘅，好似其實呢個咧就一個好似一個菩提子，一棵樹咁，係咪？咁其實咧嗰個血管咧就開始有少少好弱啦，咁就開始一路脹大，即係流咗血出嚟咧，變咗一個波咁喺度。咁嗱，好事咧就係呢啲咁咧就 compress 喺即係掂到腦裏邊嘅神經系統啊，同埋細胞，咁你又開始有感覺。第一，好似或者頭痛啊、好痛啊，或者係好似睇唔到嘢啊，眼盲開始蒙啊 ，double vision 啊，會 affect 到你就可以睇到咧。咁你就要可能要即刻去做嘢。嗱，做嘢咧都係好多時咧都係要開刀嘅呢個。咁但係最弊咧，如果呢個忽然間已經係爆啦 ，burst， 咁呢個咧就弊啦，好嚴重。點解咧？呢啲爆咗之後咧，就開始流啲血咧，就喺腦呢度裏邊咧係咁流喎。咁如果係咁流嘅時候咧，咁嗱流血咧，你就可以揾隻手撳住佢咧，但係腦就冇得撳嘅喎。咁點啊？咁要開刀咯。但係如果你開唔到點樣啊？咁就死亡率係好高嘅。咁嗰陣時咧，呢啲咁嘅問題咧。好多人咧係嚴重到咧就係即係叫即刻中風啦。咁如果係呢度咁樣流好多血落去，個腦開始損壞啦，咁你失去知覺啦。咁好多時咧呢啲病人咧都係即係死亡係好高。咁同埋如果你死唔到嘅話咧，好弊咧可能咧你個腦咧亦都有做一個好大嘅損壞。咁你係一個長期要揾人照顧，仲要瞓喺度，哇！真係陰功啦。咁所以變咗嚟講 ，that's why 我哋要即係盡量咧唔好去呢笪地方啦嚇。OK， so just review a large bulge of like this little ball, a blood vessel in the brain, and they're large enough, they start pressing against the nerve and tissue. Then basically it's better than just a hemorrhage, aneurysm, because with that at least you start having some sign and symptom, you can do something about it. But if you just burst, wow, That's tough because you cannot, you don't really have feel. You just suddenly become unconscious, or you have, this pain, or now is start bleeding, and even go to hospital. You start this CT scan. You start saying this bleeding. You might not even have a chance to live on, but you have to go surgery right away, whatever. But you're old, most likely a doctor would say, well, if you are 60, 70, depends. The doctor might say, well, you kind of age, so maybe the risk will be high. It might not even do anything for you. If you're 80, for sure, they might just say, well, the risk of surgery is higher than you need. So they might not really do much for you. So end up you will die. 嗱，記住，因為個 balloon 因為上咁大個上嚟之後咧，咁佢凸起咗啦，咁好多時咧會壓到你嘅腦裏邊嘅神經或者細胞啦，咁就俾一個信號俾你，咁就可能頭痛啦，或者有個眼睇唔到好蒙啦，或者係睇到 double vision 啊嗰啲啦，咁幾好事嚟嘅喎，因為最咧你知道啊，但係如果一流血嗰啲咧，你唔知道一爆咗之後咧，咁好多時咧你就會 end up 就會死亡嘅。咁同埋就一係就開刀，但係開刀當你老嘅時候開刀機會唔高啦，因為你係個 survival 唔高嘅，咁醫生都未必同你開刀。OK， now but if you actually get this sign, as I said, is a good thing because when you have cerebral aneurysm, it press against the tissue. So usually, usually the common thing is you have vision problems like double vision, and then you have a drooping eyelid. So that's why if you see people, they start drooping eyelid at one side, and they're also sensitive to light, and they could be a pain behind the eyes because that's where the pressure is going to be, and could be also a dilated pupil. I saw a lot of this one when I'm an ICU nurse. They might be a nausea and vomiting, and they also, many of them are lost conscious, and they have numbness, weakness, paralyzed one side of the face. Now all that really become the sign of cerebral aneurysm. It doesn't require you to go to a regular doctor. You go to where? ER, emergency, right away, because this is really a critical time. Cannot say, well, I'm going to call a doctor, give me a doctor appointment. Oh, 3 days from now, okay. Forget that. Go to ER right away because this time is the essence when you have that problem, okay? Time is the essence. 各位朋友，如果你係譬如個動物係有一啲嘅就扭壓住啲神經嘅時候咧，咁你有少係會有不同嘅警告信號出現嘅。個警告信號咧就會有視力嘅問題啦，有 double vision 咧睇到兩樣嘢啦，或者兩個好似得 focus 咁嘅，眼皮係垂下啦，或者見到光好似哇好敏感啊，眼後邊咧會痛啊。同埋咧個瞳孔會脹大咗佢啊！如果你用射燈落去咧，應該瞳孔會反應噶嘛，而家會脹大咗喎，唔喐嘅。咁同埋你會嘔吐啦，同埋會sorry，你會係即係暈咗啦。咁同埋咧有陣時一個面部有麻痹啊，冇晒力啊，呢啲係全部呢啲咁嘅係嘅即係警告信號出咗現嘅嗱。其實呢個咧，當你有呢樣嘢嘅時候咧，就唔係話你去見普通醫生，唔可以去見咧。依家就即刻要去急症室，因為咧呢個咧你唔知道幾時爆啊嘛。咁好重要咧，有呢咁情況下咧，即刻去咩啊？急症室，唔係話去你普通嘅醫生嗰度，因為咧每一分鐘都係可能會令到你個生命有更加危險嘅情況嘅。So it really common. Is it really common in cerebral aneurysm? Now, in the United States, there's about 6.5 million people in aneurysm per year. So in other words, you have 1 out of 50 people is going to have aneurysm. Wow, that's a lot of number. That's a high number. And aneurysm rupture is about 8 to 10% so per 100,000 people. So about 30,000 people in the United States every year are suffering from brain aneurysm rupture. In other words, the actual burst, okay? And that rupture, You can even call it every 18 minutes, you get one, okay? And women are more prone to get brain aneurysm rupture compared with men. And also women, particularly those over 60, 55 and above, have more brain aneurysm rupture than men. So about 1.5 times more risk. So actually, that is absolutely true. Even in my past experience in ICU, I saw more women comes in with aneurysm, and also many of them actually died because, and even though they try to save them, especially elderly, 70 years old, they usually die. And I found that even many of them try hard with the brain surgery, but the survival is still going to be poor. The problem is they have to be, after the surgery, the recovery times are so long. The person will be lying in bed for years, 2, 3, 4 years. And then you have to go to a care home. They can't move. You have to care. And they have bad ulcers everywhere. They keep coming to the hospital again. Man, wow, it's so suffering. And they can't remember you anymore because the brain is damaged. So I had, to be honest, I have so many, patients that I treated. I felt so sad for them because of the fact that, family care has tremendous pressure, and they themselves, the patient himself also, certainly they don't feel a lot, but they really have a lot of pressure also. So don't go into this stage. Hopefully you guys can continue to keep yourself healthy and not to get into cerebral aneurysm. 嗱，喺美國咧係已經有650萬人咧一年咧係有呢個動脈瘤嘅，咁但係咧每50個人有一個已經係喎，咁都其實好大喎，咁同埋咧每10萬人咧8至10個係有呢種嘅問題，就個瘤係爆咗流血，咁其實咧就如果你講咧多數係女人咧係多啲嘅，如果尤其是女士咧55歲以上咧比男士係多咗1.5倍嘅，咁所以如果你係女士，今次女士傾偈嗰啲咧，真係要注意個啦，咁變咗嚟講，希望你哋咧就千祈唔好去咗依度啦。個原因咧，我係 treat 咗好多病人咧 ICU 做 ICU nurse 嘅時候，即係好多女士咧係死或者唔死得。嗱，如果唔死得咧，仲慘，因為佢咧，如果譬如開咗刀，咁佢就捱咗一段時間3、4年或者2、3年，咁但係佢呢個全部喐唔到喎，佢瞓床喎，喺個 care home 嗰度喎，咁佢 end up 就好陰功啦，咁佢又要俾人照顧啦 ，cost 好高啦，咁有好多床嘅瘡出現啦，哇，好受苦啊！所以呢個咧真係希望大家唔好去呢度 ，OK？ 咁啦，仲有啦，冇人問咧咩叫做動脈瘤嘅原因啊？點解會有呢樣嘢發生啊 ？So what's the cause of cerebral aneurysm? So everybody has to understand because there is certain cause of cerebral aneurysm that you might able to prevent actually. Now the first cause is high blood pressure. Now, if your high blood pressure is 210 or 220 over 110, that's very high, meaning you know how blood pressure is going to go? When your blood pressure going up, boom, and that is the systolic blood pressure, because the blood pressure going up like this, that's systolic, and come back down, and the remaining pressure of the blood vessel is diastolic. So in other words, the blood vessel come up, boom, you are 220. And then when coming down, the remaining pressure is all 110. So blood pressure is extremely high. So the chances of you, for example, if you have a vessel that is already had a balloon, this is the one that is already weakening of the wall, and it bursts, boom, and then you have a real issue, right? So that's why I said one of the prevention is you have to continue lower your blood pressure. Don't get high. If you have medication, take that medication. I'm going to talk more about it. Give you one example. A good friend of mine, mother, her blood pressure, she just forgot to take her blood pressure just few days. Unfortunately, with that, the blood pressure continue goes up and up, just like this, 220 and over, and guess what? It bursts, and she has the aneurysm. And lucky she was able to survive a bit, but on the hand, the long-term care is so tremendous. Wow, tremendous. So it's not really good to be in that stage. So don't get into that, really. Be healthy, prevent your blood pressure high. Your normal blood pressure should be 120 over 80. 120 over 80. Don't let it go above 140 or so. You got to take a medication, that's for sure. Okay? 嗱，各位朋友，你其實可以控制到，即係唔係控制到啊？係可能係 prevent 到啦，防禦到咧你個 aneurysm 嘅。點樣咧？就係第一，唔好俾自己高血壓。嗱，高血壓咧就係如果你嘅血壓係220度至110度，即係話咩叫220度啊？即係個血將個肺間高咗上嚟嘅時候，呢個咧就係個高上壓，就係當血泵咗去嘣，然後落翻嚟。咁呢個就係上壓咧就有220度，下壓咧就係個 remaining 嘅 pressure of 個血管咧就係110度。咁呢個係咪好高啊？當然高啦，因為平時120至80嗰嘛，呢個上嚟120人80，但係你而家220喎，110，咁呢個咧係高血壓。如果你防住高血壓咧，咁你都唔會有 aneurysm 啦，係咪？如果你高到咁高嘅時候，你血管就爆，就係咁爆翻嚟啦。咁呢個咧就好慘啦。所以希望咧大家真係努力咧，第一控制高血壓。如果唔控制高血壓咧，你個機會咧就係一個好大問題咧，上出嚟咧有即係爆呢個血管嘅問題啦。咁正常血管係咩啊？120 over 80嘅呀，120 over 80 ，OK？ So we talk about we talk about already on this about how the blood pressure up and down. So you make sure you continue prevent yourself on high blood pressure. Okay, then you're able with that, you have less chances to get your aneurysm. So blood pressure is one of the key things to prevent your aneurysm. OK， 所以高血壓就要好緊要咧，就防止你有呢個腫瘤個血瘤爆炸啦。OK。Now another problem you have is atherosclerotic disease. OK. Now this is also can lead to aneurysm. The reason is because when you have, remember when you are diabetes or pre-diabetic, you start forming all these plaques on your vessels. Remember that in the first slides, because your LDL cholesterol goes up and then it mixes up with the blood becomes thick and start forming plaque everywhere. And this is the problem. When you form plaque everywhere, you know what? The space of the vessel become what? Smaller. And then plus your lipid, cholesterol are accumulated in the arterial wall. So you are forming what they call atherosclerosis disease. Okay, all these plaque is going to cause you problem, because when you have the plaque, you will cause you problem of forming hard substance on the vessels, and it was destroying your artery and restrict flow, and worse that if you had weakened this area because you build up pressure, it start forming a bulge, right? Or it form a clot, a blood clot, and then you have problem. Not only aneurysm, could be coming back with a stroke. Okay, and that is very common to many of the diabetic patients. Okay, because their cholesterol is very high and they're forming plaques. And then eventually, blood pressure is continuing to build up. If the vessel wall is weak, it starts getting a bulge out. And then eventually you have an aneurysm there. Or if not, it will just plug up so the blood cannot go through. The part of the brain will just basically get damaged because you have no blood passing through and become a stroke. So you have all these issues can come along. So that's why common diabetic patient has to be watching this, because this is very common for many diabetes patients. 嗱，當你動脈咧係硬化咗之後啊，咁個問題咧記唔記得頭先第三張 slide 所講過啦？如果你係糖尿病病者嘅話，咁你嘅呢個 cholesterol 一路升翻上去嘅時候咧，咁就好有問題喎，因為咧 cholesterol 同埋啲血咧就變咁好結啦，咁你就開始 form 咗好啲咁嘅 plaque 咧喺個血管嗰度。當你 form 咗一個 plaque 喺血管嗰陣時候咧，咁你血壓會上升啦。但係最弊咧，呢場咧，好似 for example 啲血管個窩血管嗰度咧，如果你個血管唔係咁健康嘅話，多數咧就煲咗出嚟，好似個波咁彈出嚟。咁一波彈出嚟嘅時候咧，咁嗰啲血塊咧就可能塞啦。咁仲有一個好大問題喎，因為呢個情況係點啊？可能爆啊！爆嘅時候就係頭先我所講呢個問題出現啦。如果啲血係咁塞咗之後咧，咁你又會有一個 stroke 喎，因為啲個腦細胞會死噶嘛，係咪？咁所以其實咧，所有糖尿患病者咧，好多時都見到呢樣嘢嘅。所以其實咧，你要記住咧，就唔好俾個血管硬化啦，同埋咧血液咧應該流得好順暢啦，唔好有啲咁嘅血塊斑塊喺度俾喺個血管嗰度啦。咁所以糖尿病病者一定要咧，我依家只再講點去防禦嘅東西，就一定要做呢個工作嘅。如果唔係咧，呢個咧就好容易發生喺你嘅身上啦。Now, one of the big risks if you're type 2 diabetic, the problem is since you already have diabetes, and your body really can be, as I said, the plaque start forming, atherosclerosis there, and if adding on the high blood pressure, because your blood pressure is high, then you certainly, a lot of people have not changed lifestyle, so they continue to take a sugar, cholesterol, blood become very thick. So now your aneurysm are even more possible being formed. Okay, so really at the end of the day, your aneurysm, if you have diabetes, your risk is high. The reason is because you're going to add on your plaque. Remember the plaque on page 3 that I talk about? Cholesterol and sugar add together, the blood becomes thick. So you have a lot of plaques start forming all over the body, including your brain. And then also, if you're not controlling your blood pressure, your vessels are continue forming plaque. Eventually it bulges out, and your blood pressure start forming, become higher and higher, and the vessel become weak, is not able to handle that. Then you have a burst, hemorrhage, become a hemorrhage aneurysm. That's how it occurs. So if you're type 2 diabetic, you got to be extra careful. You have to develop aneurysm, and make sure monitor your blood pressure, blood cholesterol, and your blood sugar. All that has to be closely monitored. So that way you will not end up to be the issue that, I just mentioned about. So make sure that keep that working hard together. 如果你係二型糖尿病病者咧，其實你係增加咗你自己嘅呢個動脈瘤嘅風險嘅，因為點解咧？第一，你血糖上升啦，你嘅膽固醇亦都上升，加埋啲血好結係咪？咁就變咗咧好多 plaque form 晒，成個腦啊都全身都有啦。咁但係當你又加多樣咧，就血壓亦都上升喎。咁你冇 control 血壓喎，咁你個血管咧，你嗰啲波咧，個血管個波咧就開始度係咁大啦，喺血管係彈咗出嚟個 aneurysm 啦。咁呢個 aneurysm 好大問題喎，如果佢爆咧，咁你就已經係即係出現咗頭先所講嘅全部嘅問題啦。咁你可能會死亡啊，或者瞓床瞓2、3、4年啊，好慘呢個東西。咁所以變咗嚟講咧，你中風嘅風險咧係高嘅，因為咧你係 如果你係糖尿患病者咧，一定要成監仲係幾樣嘢咧，血糖啦、膽固醇啦同埋血壓。So what other risks besides diabetes will be your cerebral aneurysm? Okay, besides your diabetes. Now there's lots of other risks. Okay, for example, you already have diabetes, and especially, or you don't even have diabetes, you still have this risk if you are high fat cholesterol. In other words, a lot of people who already see themselves, wow, my cholesterol is high. And basically, in Hong Kong, it will be 4, in the United States, it will be 140, 150. So high cholesterol. Now, that could be due to your diet, could be, exercise, could be whatever reason to catch yourself a high cholesterol. But it could be also family problem. I have people are not chubby, they're not obese, but their family history are high cholesterol. So they are pretty much like a normal person, but the cholesterol is very, very high. They're not fat at all. So they really need to have medication to help them. But if you don't take care of that, then the stroke will be extremely high. And sad part is these people, when they have this aneurysm, they usually very much die because of that. Smoking is another risk if you smoke. And later on, I'll tell you why, because smoking, you actually increase your cholesterol go up. Obesity is another one. You're overweight and BMI over 30, you're obese. And that's definitely will end up your aneurysm will be high. Family history of brain aneurysm, for example, your mother, dad has it, you have also a higher chance. Alcoholism is also a high incident of risk factor. And certainly certain blood infection, that will be the added more factors, that potential risk factor for aneurysm. So all these, if you have one of these, like smoking, you can prevent it. Don't smoke. If you're obese, you can do something about it. Exercise, lower your weight, get down to less than 23 BMI. You can do it. And then cholesterol, too high. Yes, diet control. And you can do it. Alcoholism, not drinking. You can do it. So all these, even though you have this high factor, you can prevent it. Okay? 嗱，其實有其他，如果你唔係糖尿病，仲有咩風險咧？嗱，高血脂肪、高膽固醇。嗱，依個咧就係因為好多時你個 diet 係嘛，食嘅即係習慣啦，呢啲可能令到係咁嘅，有可能都你家族嗱，未必一定肥嘅，因為我有好多呢啲咁嘅病人咧嚟到好鬼瘦喎，仲瘦我啦。咁但係咧佢亦都有同樣嘅好高嘅膽固醇問題嘅，咁因為佢家族嘅問題。咁食煙咧又 definitely 有呢個問題，肥胖亦都呢個問題。同埋你屋企已經係有人有個動脈瘤嘅家族嘅遺傳啦，咁呢個亦都會有啦。飲好多酒啦，烈酒啊，記住飲好多烈酒啊。咁同埋咧就有些血液嘅感染啦，呢啲咧全部咧係令到有 potential 咧，令到個風險係整到好高嘅。咁啦，其實如果你係高脂肪，係咪可以改變到啊？食咁多肥膩嘢，食咁多高脂肪嘅東西，係可以減低嘅風險嘅喎。唔食煙亦都係減低風險嘅。如果你肥胖係做 exercise 啊，降低磅數啊，跟 under 你嗰度23個 BMI， 亦都係做到嘅喎。咁亦都唔好飲多酒，淨唔飲酒得唔得？得。咁其實呢4樣嘢咧，其實都可以降低你嘅風險嘅。所以其實咧，呢個嚟講，你係做到嘅東西嚟喎，唔係唔做到喎。OK。Now, certainly other factors, including low estrogen level, polycystic kidney disease, drug abuse, sort of family history of heart condition, arteriovenous malformation, old age. Now, all these basically are other factors that you might potentially end up aneurysm. But on the other hand, the previous page, a lot of those factors you can actually prevent, right? 仲有其他嘅風險就好似話你個 estrogen 水平唔穩定啦，同埋你個腎有個多啲瘤喺度啦， 咁同埋咧就濫用嘅藥物啦，譬如係我吸毒嘅，咁呢啲係亦都有啦。咁有心臟病嘅問題啦，即係家族已經有心臟病啦。咁同埋咧有植物咧係嗰啲動脈嘅嗰啲血管啊，係全部啲形狀咧係好奇形嘅形狀嘅。咁就係年老啦。嗱，呢啲咧係當然啦，係未必你可能夠控制到，但係咧都可以做嘢嘅，就係即係食啊，同埋運動啊，同埋減磅啊嗰啲係重要啲嘅。因為我覺得未必咁多人都係有即係濫用嘅物啦，吸毒啊唔係咁多個啦嚇。咁所以變咗嚟講，但係最緊係知道，如果你家族係有心臟病嘅，咁你要即係注重下啦，係咪？咁啊能夠做到一樣嘢啦。So how do you reduce the risk of aneurysm？ 其實點能夠降低你個動脈瘤嘅風險咧 ？So that is something you have to understand, and it can be doable. Definitely can be doable to reduce the risk of aneurysm. Now, first of all, alcohol is very, can be potentially detrimental, especially if you have high blood pressure. So when you drink, you have to drink really moderately, very little, basically. Alcohol actually increases the blood pressure as you continue to drink. And also another thing, increase your calories, and then you also make you gain weight. So all these things is not good. And with that, your blood pressure will also continue to go up. So that's not so good. So I would suggest if you don't have drink, don't drink. Or you limit your alcohol intake very minimal. Now, if you drink in a week, only drink 14 units. What is meant 14 units? Now, example, a small glass of 125 mils of red wine or rosé is about 1.5 units. So you can basically gauge yourself. You drink 125 mil rosé one each day, you already gain 1.5 units. So basically meaning that you pretty much have about 1/4 glass of red wine is good for you every day. So basically you need to follow something like that to close to your 14 units a week to allow you to to enjoy alcohol but not a lot. Okay? 嗱，當然啦，我知道咧，好多人都希望飲下酒嘅，唔緊要，你可以飲，但係唔可以飲多過14個單位。咁你咩叫14個單位啊？嗱，如果你有一杯紅酒細杯125個毫升嘅酒咧，咁嗰度咧係大概 1.5 unit 嘅。咁啊，一個禮拜14個 unit 咪計翻出嚟咯。咁啊，大概每日都一杯或一杯半啊，咁你咪可以做到呢樣嘢啦。咁因為酒咧個問題咧，你飲咗酒咧就增加咩個血壓上升，同埋咧你亦都增加你肥胖啦，同埋咧亦都個酒精升咗上嚟嘅時候咧，你可能你血壓就會繼續上升嘅，所以呢樣嘢就唔好飲多酒啦。Now, this is one very important because I know a lot of people not necessarily drink liquor or alcohol. More important, you really got to control your blood sugar. Now, either you have pre-diabetic, diabetes, or you just have cholesterol go up. You can still lower your blood sugar regularly, keep it at a healthy range, less than 140 milligram per dil, or 7.8 millimole per liter. Now, that is important because when you have that, your A1C most likely will be less than 6.4. You know, you even though you high A1C at 10 or whatever, eventually move yourself down to low 6.4. That's when you are in a pre-diabetic stage. So you need to do that, which you need to follow your diabetic meal plan, and you got to keep yourself very hydrated, drink LOWSUTEA 2 liters per day, reduce your sugar intake, in other words, you can only take 150 milligrams of carbs a day, and eat a healthy diet. Half of them is all vegetable, 1/4 protein, 1/4 is your starch, which could be brown rice. So controlling your blood sugar is truly the key to help you keep yourself healthy. 嗱，控制血糖咧係好重要嘅，因為咧，如果你控制血糖咧， 咁當然啦，第一你要定期飲你去糖茶啦，第二咧就保持你個血糖係140個 milligram per day 或者7.8 millimole per liter 啦，低過呢個啊，低過呢個啊，記住啊。咁你成日都要即係每3個月去睇一個 A1C 幾多啦。咁其實你個 target 咧係應該係 less than 6.4嘅 ，OK？ 記住 target less than 6.4，因為我見到好多朋友依家由7唔係 sorry 由10去到7㗎啦，或者7掉落去6.4，見到好多嘅，佢哋全部都係繼續飲佢去糖茶啦，繼續食佢個食材嘅計劃啦，保持佢水分高啦，飲2個 liter 嘅去糖茶啦，減低糖嘅嘅吸收啦，咁食得係健康嘅。咁佢健康係咩啊？一半係全部係菜，綠色任何菜都得啦。1/4咧係咩嚟㗎？係魚啊、瘦肉啊嗰啲咁嘅東西。4分仲有咩啊？係就係嗰啲紅米啊，食嗰啲咧，咁變咗嚟講咧，佢繼續係將個糖咧係繼續降低嘅。哇，幾好啊！ And you have to stop smoking because the problem is smoking increase your fat in your blood, increase your triglyceride, decrease your good cholesterol, which is HDL. But then you have, because of the fact that you smoke, your blood will be more prone to clot and become sticky, and then you obstruct blood flow to the brain and heart. So smoking is not only able to give you more chances of lung cancer, but all these problems, increase triglycerides, decrease good cholesterol. Wow, stop smoking, man, because that is really can help you to prevent all sorts of potential future disease. Okay, so get some help on smoking. Stop smoking. Try some out to stop smoking. 嗱，食煙咧係一個好大問題，因為增加咗三甘油酸嘅度數啦，膽固醇又會由 HDL 好嘅膽固醇會降低啦，咁同埋令到啲血好結喎，咁變咗嚟講咧，呢啲嘢結嘅時候咧，血咧就令到可能啲血入唔到腦啊，或者心臟，哇幾正啊 ，OK。And also, when you find out 40% who smoke, 40% aneurysm are ruptured because of smoking, okay? And they actually damage the blood vessel wall, increase plaque forming on the arteries with fat, cholesterol, calcium, and other material. And then it causes the blood vessel become thickening, okay? So really, smoking can be a very big damage. So you got to make sure that, not to smoke. 嗱，食煙咧其實真係一個好大損害，頭先我講好多啦。仲有咧，其實40% 嘅動脈，如果係爆炸嗰啲咧，就即刻穿咗流血嗰啲咧，係多數係食煙人士嚟嘅。咁當然啦，吸煙咧亦都損壞咗血管嘅個內層裏面嘅細胞啦，血液亦都放好多板塊啦，加埋你嘅膽固醇啊，同埋你嘅脂肪啊，同埋咧仲有咧個血管咧亦都越整越窄嘅，所以一定要好好食煙 ，OK？ And you gotta really stay active because when you stay active, meaning you can walk, you jog, you swim, you're dancing, you gotta try to exercise every day, and you lose 10% or 5.7 or 5 to 7% of your weight is really good because you lose 10% of weight, your A1C will drop 1 point. In other words, your A1C is 8. Now your A1C will be 7. And every day you should target at least 30 minutes of exercise, 5 days a week, at least 150 minutes per week. And if you need to have a fitness coach, is good. Continue work with them. Or you say, hey, I don't have a fitness coach. That's okay. Just walk. Walk by neighborhood. Go to a shopping mall. Walk 1 hour. That will be perfect, especially after dinner. You relax your brain. It will be so much better. 嗱，做運動好緊要嘅，因為咧做運動咧最低限度咧，你能夠可以做下散步啦，或者游水啦、跳舞啦，任何散步啊、跳舞都 OK 嘅。最重要係喐 ，OK？ 嗱，咁你亦都如果你有overweight 磅數啦，咁如果你降低10%你嘅 body weight， 即係如果係220磅嘅，我依家降到係200磅嘅，你個 A1C 係 drop 1個 point， 即係話你係8，依家會7嘅 ，OK？ 咁每週咧就應該 係做最低限度30分鐘以上嘅 exercise，同埋總共係150分鐘啊。咁最低限度你繼續係去做 exercise，繼續咧，咁令到你咧血液循環更加好，亦都唔會 form 咁多 plaque。OK， now your diet has to have all the bad cholesterol. You have to let it out, man. Don't eat those bad cholesterol. Okay, so you have to remove all the trans fat, low salt diet. You have to make sure that you remove trans fat and eat low salt diet. Okay, the reason is because salt increase what? Blood pressure. Okay, so you don't want to get more salt and then you start having a high blood pressure. And trans fat, for example, to be honest, McDonald's are not very good food for you. Once in a while is good, but you eat every day might be a real issue. So get rid of that too. And then you have to end up lower your body weight and also eat a lot more fibers. Like, for example, I didn't tell you to eat white rice anymore. I tell you to eat red rice. Then there's a lot of fiber. And then you have to limit to eat any kind of processed food, like canned food or whatever, and drink plenty of water and LOWSUTEA, because LOWSUTEA help you to hydrate you and help you to detox. And then also you have to eat one more thing, high omega-3, like salmon, sardine, tuna diet. Okay, those are things that are really good for you to cut down your bad cholesterol. OK， 要減低壞嘅膽固醇，點減啊？第一，唔好食咁多真係肥嘅嘢，好似即係 trans fat 啊、反式脂肪嘅東西咧，去麥當勞咧就減少多啲啦。咁同埋咧，最緊要減鹽啊，因為當你減咗鹽之後咧，你血壓咧就唔會上升嘅。咁所以變咗咧，減完咧係幫助你降低血壓，同埋咧仲有降低重磅啦，仲有咧就係你要食多啲纖維嘅食物啦，好似菜蔬啊、紅米啊，咁同埋咧就限制嘅高度加工嘅食物啦。好似 chips 啊嗰啲東西啦，同埋咧就飲多啲去糖茶啦，每日飲2個 liter 去糖茶啦，最重要嚇。咁然後咧就更加食多啲 omega-3嘅食物，好似魚啊、三文魚啊、倉魚啊、同沙甸啊啲東西，呢啲係 good omega， 對心好嘅，同埋對身體入得好嘅。Now, very important, you also have to control your stress. As you remember, stress can actually give you motion, increase your blood pressure goes up. So you will get angry, it will cause you potentially aneurysm can rupture. So you have to manage your stress, relax, do meditation. You have to have time management. Don't lead you to rush. Stress. So you have to lead your time with a more balanced, relaxed lifestyle. Journal what you did, so you know you are able to control what has stressed you, and spend more time with family and friends. Talk about issue, talk about your happiness, share more. And if you do that, you're more relaxed you, and you can maybe even start a hobby, making flower planting or whatever. It's important to manage stress. If you're less stressed, your blood pressure will not go up. It will be better. 嗱，好重要管理嘅壓力。如果你壓力係唔係好大嘅話，咁你血壓唔會上升。咁你情況上咧，你係情緒唔高咧，你個爆炸機會咧，你個 aneurysm 爆炸機會係少咗嘅。咁咧你放鬆啦，成日諗好啲嘢啊 ，be positive 啦，管理時間啦，平時生活啦，我哋寫日記咩能夠 stress 你，或者知道邊嘢唔 stress 你，做多啲嗰啲啦，同朋友、屋企人分享多啲啦，講下傾下偈啦，令到你自己更加 relax 啦，仲有開始一個好嘅習慣 ，for example 種下花啦，或者係做下不同嘅東西，有啲人係中意去做啲小工藝啊，嗰啲 OK 㗎。最緊要令到 whatever 你做咧能夠 relax 更加好嘅。Okay, now we learned a lot today. I think importantly you have to understand aneurysm. There are a lot of things you can prevent it, and the important thing to prevent it is not to get the brain being bleed, and also because you not able to treat it once it bleed. Either you can use a surgery to stop the bleeding, but if you are 50, 60, 70 years old, the chances of surgery might not be good. or even after surgery, your recovery time will be tremendous long, like few years. You have to stay in a bed. That is no good quality of life, right? So you don't want to be there. The most important to prevent your aneurysm is living a great lifestyle, healthy lifestyle, and control your blood sugar, control your blood pressure, and cholesterol. That will be really very important. So more important than, so lower your blood pressure, lower your cholesterol, lower your blood pressure, and also quit smoking. Don't use drugs, reduce your alcohol. So that way you can be healthy and changing your lifestyle. So that's the most important. 嗱，結論之後咧，就係我哋其實咧，你可以會去咗有呢個動物瘤喎，因為咧，你如果係做一個好嘅生活習慣，好似嚟講控制你血壓啦，你嘅壞嘅膽固醇唔上升啦，血糖嘅水平係一個 normal range 啦，戒煙啦、戒毒啦、冇飲酒啦，咁呢啲嘢全部咧唔會損壞你血管，咁你呢個動脈腫瘤咧個機會 form 咧就少啲，咁一定要能夠令到你身體繼續健康嘅。咁如果身體健康咧，個 chance 呢個發現咧就唔高啦。OK， 咁依家係點去做呢樣嘢啊？咁我哋依家再講啦。So how do you get a healthy lifestyle and reduce the weakening of blood vessels? So very important, first of all, control your blood pressure, because blood pressure is a key. If your blood pressure over 220 and you have already an aneurysm, boom, and you will basically potential risk of dying because the aneurysm burst. Then you have to control your blood sugar. And blood sugar level, as I mentioned, your diabetes, your blood sugar continually high, your blood vessel become hardened, all that will be a factor and create bad aneurysm, right? And if you drink moderately. A very 1/4 glass of wine every day is okay, but not more, because if you get more, it increase your blood pressure. If you smoke, you stop smoking, and stay active, exercise 30 minutes a day, and 150 per week. That will good. You have to manage your stress and maintain regular bedtime. Make sure that sleep at the same time all the time, and wake up at least a 7-hour sleep. Eat healthy, cut off the bad cholesterol. Make sure to eat half is really just vegetable, 1/4 is your protein like fish and lean pork, and 1/4 will be your starch with, like, for example, red rice. And take your medication, very important, take your medication, especially your cholesterol and blood pressure medication. A lot of people forget that medication. You know what? Then 2 days later, the blood pressure got so high and burst, boom. And last but not least, drink LOWSUTEA, because it will help you on your cholesterol, your blood sugar, and your blood pressure, and detox. And very important, you drink that, you help you to also lower some weight. So for sure, your blood sugar go down, your cholesterol go down, your blood pressure go down. All that will create the environment for you to aneurysm, and that at least lower that risk. So hope all of you can able to follow that. You can take a picture of that if you want to, and that will help you at least prevent yourself to become a victim of aneurysm. I don't want you to be there, because I saw so many patients who are real suffering, and that's not good. 嗱，各位同學，咁你問下，喂，點樣叫健康生活能夠減低我呢個血管嘅壞嘅病啦，呢個 aneurysm 啦？咁第一好重要咧就控制到你血壓啦。如果你控制唔到血壓，嗰個 chance 嗰個波會爆咧係高嘅。咁同埋咧，你控制血糖嘅水平喎。如果你 A1C 成日好高咧，你血管好硬化啦，咁變咗你個爆機會亦都高嘅。咁同埋飲酒唔好飲多啦。每4分1杯嘅酒，仲要啦，戒煙啦，同埋保持一個活躍嘅生活啦，做 exercise 啊，每日做30分鐘啊，行啊，最好噶啦，行好容易嘅咋，係咪？咁你仲有管理自己壓力啦，唔好太大，因為壓力咧 increase 咩？一樣嘅血壓啦 ，OK？ 咁就係食嘢要好健康啦，咁飲食咧就要減低啲壞嘅膽固醇啦，即係唔好咁多麥當勞啊。好重要，唔好唔記得食藥，因為血壓藥唔記得食咧，個機會你去爆係高嘅。因為我見到太多病人係咁啦。如果佢唔記得食藥，2、3日、4日後5日啦，咁佢一路係咁升上去嘅， 最後有邊人得嘅話，個血管爆咧，咁就喺嗰度爆啦。咁所以老人家尤其是咧，好多時唔記得食藥係好多常見嘅啊，記住啊。咁啊要飲血糖茶啦，因為血糖茶係幫助咩啊？降低膽固醇啦、血糖啦、同埋血壓啦，仲有排毒。三高係降低，咁就變咗你個風險亦都會降低。咁所以繼續飲血糖茶會十分幫助嘅。So imagine, remember, diabetes is a chronic. If you don't get well, you can only control. Pre-diabetic is the same. So you make sure that you continue to take care of your diet. If you don't do anything, change your lifestyle, like exercise, dieting, weight control, you basically will most likely will convert. So changing your lifestyle is so important. So, and drink LOWSUTEA will definitely help you to lower your 3 high. And that's what we hope that we'll do. We hope that we're holding a hand throughout this journey, continue to motivate you, continue to work with you to lower your blood sugar so you can be a healthy individual and have a wonderful life along the way. 各位同學記住咧，糖尿病者前期問一樣嘅，你係唔會好嘅，你只能夠控制。如果你控制點做啊？你一定要你有個食物嘅控制啦，有運動啦，要降低磅數啦，咁同埋咧將你個即係繼續係維持嗰個生活，就飲血糖茶啦，仲有咁能夠令到血糖降低，咁你咧就可能夠咧繼續係可以一個好健康生活。如果你做唔到呢樣嘢咧，3年咧好多人都會轉咗嘅，咁呢個係一個好大問題。所以希望你各位係繼續努力，係管理你個成個身體嘅糖嘅最多係降低血糖啦、膽固醇啦，同埋血壓啦，繼續排毒。咁飲咗血糖茶係會幫助呢樣嘢嘅。So any question? And this is our website. I hope that you can able to have any question. We can hope to answer you and that. We can able to provide you some answer. So any other question for now, for example? And you want to write to me for a question, you can also write to andy@wafong.com. You can do that. andy@wafong.com. You want to write to me. Okay. Well, I hope you guys are enjoying your wonderful Christmas holiday and continue to be healthy because that is important. I hope that you'll be always think about, lower your blood sugar via better dieting, more fiber. You can still enjoy a lot of life. I do that all the time. I enjoy my life. I can measure blood sugar and know that we're in the normal range. Then you will be at ease, continue to be good and enjoy your family. And if you need, write to me, Andy@wafong.com if you can, or call us out. And this is our phone number, and WhatsApp us, or call us, and you can take a picture of that too, and you can do that. Important is write to us, and let's see, buttermilk leaves. Okay, Gordon, I don't understand this. What was this called? Can you eat raw buttermilk leaves? Wow, that one I don't know. That would that be raw buttermilk leaves? That one I'm not familiar with, actually, Gordon. Thank you for asking, though. That one I'm not sure you can eat raw because I don't know this buttermilk leaves much. So maybe you gotta look up a little bit more on your Google for I just know butter leaves are actually good for source of calcium and basically help you on the calcium. And a lot of time, actually, if you are low calcium, you might want to take calcium pills, which is available in the market, over the counter. Also, if you need calcium pill, that's maybe that. I don't know about. I'm not familiar with buttermilk leaves, but I know that it's good for good for getting your calcium. But I'm not sure that it's good or not, so I cannot answer you. Sorry about that. Are there any other questions? Will be good. I appreciate asking though. Bit to me. Okay. So you're talking about another thing now. Okay. So I don't know what's vitamin. I don't know what that is. Sorry about that. I don't quite know what is vitamin. You mean bitter melon? Bitter melon is, but I don't know what is vitamin. Vitamin. That one I'm not familiarized. Vitamin. Okay. Sorry about that. Sorry I couldn't answer that vitamin. The bitter melon is definitely good for you because that's the one that increase your insulin sensitivity and dump bitter melon actually dump sugar, cholesterol, and out into your urine. So it's really good for you. But I don't know what is vitamin. Okay. Sorry about that. One more thing. Because next week is Christmas holiday. So on the 24th or 23rd, we're not going to lecture. Our next lecture will be actually on the 13th of January. 13th of January. So I hope that we're going to see you on the next lecture. Will be on the 13th of January. And so I wish everyone a Merry Christmas and a healthy New Year for 2003. Continue to enjoy life. Continue to monitor your blood sugar, exercise, lower your weight. That will be excellent for you. Goodbye. Happy New Year to you. Thank you for attending. Bye-bye.